All right, we're going to bring everyone back together to start our next set of presentations. So I have the pleasure now of introducing our next speaker, Dr. Jessica Ruff, who was a med school classmate of mine. So it's so wonderful to see where people end up and what they do. And I think the first time I saw her name in a chart sharing a patient, I was so excited because I knew that the patient was seeing someone who would make a difference. So Dr. Jessica Ruff focuses on nutrition, exercise, stress management, sleep, and social connection to help patients make healthy lifestyle changes to combat chronic diseases such as diabetes, high blood pressure, and obesity. She completed her undergraduate degree at Miami University and earned her medical degree from Case Western Reserve University. Her postgraduate training included a master's degree in bioethics and a certificate in health informatics from Case Western, as well as a master's degree in public health from Meharry Medical College. So she's very accomplished, and we're happy to have her here today to talk about healthy lifestyle considerations for our breast cancer survivors.
Thank you, Megan. I am excited to talk here today. Next. Okay. All right, so I've got two learning objectives today. They'll be to describe the evidence for lifestyle medicine and cancer care, and to explain the role of lifestyle changes in prevention and treatment of cancer. Oh, I can't see my notes. Uh-oh. 1 second.
So while Dr. Ruff is getting set, I don't have a slide about this, but I wanted to make sure that we gave a plug for another Lobular learning opportunity that's coming in September. Actually, at the end of September in Pittsburgh, we have the Lobular ILC symposium. And this is a multi-day event, so this is kind of the taster. If you're interested in everything you're hearing today, there's going to be a much larger program with scientific information, a lot of patient advocacy information, and clinical information that's happening not too far from here. So please check it out, run through UPMC. I'll be there. I think you'll see many of these familiar faces there. So while we had a moment, figured I'd bring that to your attention. Thanks.
Okay, bear with me. I'm going to do this with my computer and the slides. All right, so the American Institute for Cancer Research has come out with prevention guidelines for cancer. You'll notice that these include things like what to eat, to exercise, and avoiding certain risky behaviors. So there's plenty of evidence for how lifestyle medicine can prevent cancer. Today I'm really going to focus on treatment and what that looks like in a lifestyle medicine practice. So if a poor lifestyle caused the problem, then a healthy lifestyle can correct the problem. And the oncologists agree. So as I was doing this research study, I was pretty impressed to find how much research is out there on breast cancer and lifestyle medicine treatments. So this was a study done about 3 years ago that looked at oncology practice and whether or not oncologists are discussing lifestyle medicine issues with their patients. And you'll see that around 90% of people agree that it's something that affects their patients when it comes to treatment, and they like to talk to their patients about it. What I thought was really interesting about this is that oncologists felt like they needed more information on what to tell their patients. So we'll talk definitely a little bit about that later. There is a radiation oncologist, a medical oncologist, and a breast radiologist and cancer researcher that did in 2019, did a lifestyle medicine approach to breast cancer looking at prevention and treatment. As I mentioned today, we'll focus on treatment, and I basically just went through the literature and was able to update their research with studies that were published in the last 2 years. So breast cancer and nutrition, there have been several meta-analyses done, and this one's fresh off the press, published in 2023 of July. A high-quality diet is inversely associated with all-cause mortality and cancer-specific mortality, even specifically breast cancer. The most beneficial effects of this are consuming fruits, vegetables, and whole grains. When it comes to physical activity, the evidence is also the same. When they looked at several studies for physical activity, they found that it was associated with survival among breast cancer survivors, post-diagnosis, and was in the same thing here. This was also associated with was inversely associated with all-cause and breast cancer mortality. And again, mindfulness. So mindfulness-based stress reduction was better than standard or usual care for relieving psychological stress, anxiety, depression, and sleep in patients with breast cancer. Unfortunately, it wasn't related to quality of life, which I thought was really interesting. So you can sort of fix everything, but their quality of life didn't necessarily improve with mindfulness. Typically, that's not what we see in lifestyle medicine, so I think there's just some more research that's left to be done. This is just an example of that meta-analysis when they look specifically at depression, and you'll notice that it definitely favors the intervention as well. So for people who are looking for how to find this information, the American College of Lifestyle Medicine has a board certification, and so that's an option. But for patients, there's also the ability to find a clinician located right on their website. So if a patient or yourself are interested in finding people to help them work with their lifestyle management changes, this is definitely an opportunity to do that. There are 6 main pillars in lifestyle medicine. The first one being eat whole foods that are plant-based. One of the questions I get most often was, well, doc, what's a whole food? So I tell patients it's single ingredient, it's unprocessed, or as they exist in nature. So what it should look like what it did when it came off of the tree or out of the ground. And the goal is to eat about 95% of your calories coming from these whole fruits, vegetables, grains, and legumes. In the United States, we suffer from what we call the SAD diet in lifestyle medicine, or the standard American diet. It has an increased risk for obesity, type 2 diabetes, heart disease, and some cancers. Poor nutrition, we think, is the leading cause of death globally. So what I work with patients to do is really to shift them from the standard American diet to eating a whole food plant-based plan. How much sugar is in your drink? So one of my favorite case presentations is I had a truck driver who was interested in losing some weight. He drank approximately 2 pots of coffee a day. We made one lifestyle change, which was to stop putting sugar in his coffee. He lost 40 pounds. I then found out he was putting a cup of sugar in each pot of coffee he was drinking. That being said, though, 19.25, that's just a little over a quarter of a cup of sugar. And so it's not actually that hard to get to a cup of coffee. If you have a patient who's drinking 2-3 a liter of soda a day, they're easily putting away at least a cup of coffee. So this is an easy first step to make for a lot of patients. What does a healthy plate look like? So the other thing that you can focus on patients for this is to making half of their plate filled with vegetables. And this is what I do for patients because I hate calorie counting. I try not to do anything that I try not to ask my patients to do anything that I wouldn't do, and calorie counting is one of them. It's not sustainable in the long term, and people and patients tend to get obsessed with the calories, and they lose focus on the quality of their food. So if you can fill your plate with half vegetables, you're going to be well on your way to eating a healthy diet. The other thing you want is to have a quarter of your plate be plant-based proteins, such as cooked beans, lentils, or tofu. And if you're not fully on the plant-based train yet, that's where you want your lean meats, chicken, turkey, and healthy fatty fish like salmon. And then 1/4 of your plate is going to be filled with healthy grains such as brown rice, whole wheat pasta, quinoa. There's a number of them that we don't take full advantage of here in the United States. Why are you not hungry when you're eating well? Well, it's because of calorie density. So fruits and vegetables have a very low density per pound of food. So if you're eating 500 calories of a fruit and vegetable, the opportunity for you to fill up your stomach is easy, right? 500 calories, your stomach is full. The reason patients are often still hungry when they're trying to lose weight is because they're filling their plates with meats and cheese. Keto fans out there. They are not fully filling their stomach, and they're also choosing products that are high in calories for volume. So the easiest thing you can do, again, half your plate fruits and vegetables, you'll have a full stomach and you won't be hungry. Eating mindfully is another piece of this that's very important. So mindful eating focuses your eating on sort of how you feel, how your body feels, and the thoughts and feelings related to eating healthy, or what you're eating in general. Big places here are to sit and eat at a real table, not in front of the TV or other multitasking. Don't hurry, drink more water, eat your favorite food last. A lot of times, especially if that's dessert, for me, sometimes, I want to eat that first, but I try and save it for last, because usually your satisfaction with a food occurs in the first 2 to 3 bites of a food. So you don't really need that huge slice of cake if you take your time and eat mindfully and just really enjoy the food that you're having. Find veggie-friendly restaurants. So you'll see throughout my talk that I'll talk about some technology opportunities that are there. Finding veggie-friendly restaurants is something that people feel like is really difficult, but there are a couple of apps out there that are amazing. Happy Cow is a great one, and it gives you the opportunity to find not only vegan restaurants, but vegetarian restaurants as well, or vegetarian-friendly restaurants. So my goal when I work with patients is to make this the easy choice, which can be difficult if you don't have the right resources. The other thing that you can work with patients to do is to plan your meals. So meal planning goes a long way when you get home and it's the end of the day and you're tired. Nobody wants to think about what it is that they're having for dinner. But if you're able to plan that out at the beginning of the week, do all your grocery shopping and potentially some prep, it makes it a lot easier to make it the healthy choice. I really like Mealime. It's a free resource. And so it's nice because it plans out your grocery shopping list. So you pick your meals, plans your grocery shopping list, and for those of you who are super busy, it will actually export those to Instacart or your favorite grocery store. And so all you have to do is pick it up at the grocery store and cook it. Other opportunities are Green Chef. That's another great one for Mediterranean diet where they ship the food to you and you just have to prep it. So, pillar 2, increased physical activity. First tip, don't be these people. My favorite one, I think, is the middle. He says fitness is a state of mind, so he sits there thinking about exercise. So different types of exercise: aerobic, strength training, flexibility, and balance. And a lot of times this includes activities of daily living. In particular with cancer patients, this can be really important because there's this assumption that I have to get out there and do really strenuous work. And in patients who have fatigue, that's a hard thing to do. It's hard to get them off the couch sometimes. But doing that can greatly improve their mood. So I definitely focus on this and remind them that activities of daily living count as well. The recommendation for physical activity to stay healthy is 150 minutes of physical activity a week. That just means getting your heart rate up. It's above the 70th percentile if you want, or that's considered moderate activity. Vigorous activity, you get to take a break on the time. It's only 75 minutes per day or per week, and then at least 2 days a week of strength training. The strength training is really important. That helps keep us sort of upright and really helps us to keep the weight off because muscle burns more calories than fat. The best physical activity routine, though, is rather than being unique or individualized, it's whatever the patient is going to do. So sometimes it's just starting with 15 minutes of walking outside a couple of days a week. So it's really important to meet the patient where they are and sort of develop a plan that they're going to actually use. That's the most important part. Pillar 3 is to improve your sleep. Performance is best when it's 7 to 8 hours a night. So I know there are a lot of doctors in the room who are not getting 7 to 8 hours of sleep. You're chronically sleep deprived and you just don't recognize it. Really getting 7 to 8 hours of sleep, all the literature says that less than that, so people will say, oh, I do fine on 5 hours. It's not true. It's like 5% of the population that can really do well on functioning on less than 5 hours of sleep. This will affect your ability to, your performance ability. Getting 7 to 8 hours of sleep, things that can sort of change or improve your ability to sleep well are managing your stress, not having caffeine or alcohol close to bedtime or large meals, checking your medication side effects and your sleep environment. That one gets a lot of patients. The recommended temperature for sleeping is 65 to 72 degrees. So most people sleep way, way, way too hot. Other things that you can do are to go to bed and get up at the same time every day, including the weekends, keeping your room dark and quiet, removing electronic devices from the bedroom. This is a big one. Patients often tell me that they have a TV and it's the only way that they can go to sleep, but they're not sleeping well with that noise in the background. A lot of them wake up when the TV goes off for sleep time, so it just tells you that your brain is still active as that's going on. Pillar 4 is to manage your stress. So stress management includes meditation, learning to release and or replace stressful events, getting out in the sunshine and fresh air. There was a new article recently published that said getting out into nature, specifically in the woods where it's green, is great for stress management, even more so than just walking in an urban environment. So if you have the opportunity to spend some time where it's green, that's even better. And then just resting and renewing, taking time to really enjoy and pay attention to each moment, doing that daily, weekly, and annually. So there are also a ton of apps for this. Many of you have heard of Headspace and Calm. Those are great apps, but they cost money. So I try and focus on things that are accessible to the patient. So Insight Timer, and then Healthy Minds has another one. This one's really is science-based. The articles that are published on this one are pretty cool. And I like it because it gives you the opportunity to practice meditation types in small bite-sized pieces, 8 minutes, 5 minutes, things that are accessible to patients because time is often a problem or a barrier for this. Pillar 5 is to form and maintain relationships. So social support from your family, friends, and then the people that you do life with are also really important. Spiritual support, no matter what you call it, is also important. Having a prayer, or praying, having a presence in community. Pillar 6 is to avoid tobacco and other exposures. This includes illicit drugs, pollutants, chemicals, and preservatives. So this is the big one that often ties back to food. So as we talked about the American diet before, this is where a lot of people get into trouble. Our processed foods have so much stuff in it, and they're being engineered to be addictive. So anything that we can do to prevent preservatives and chemicals in our foods is another great place for this. Also candles, things like that in the air, as much as I love them, aren't good for us. All right, and that's it. Thank you, guys.